in fact, Carrie and the sheriff are both here if you want guys come up. We also reached out to OPD, to get their input on this matter, and then also our county attorney. And so I think I'm gonna turn it over to them to kind of talk about, kind of their preferences going forward. You guys wanna come up?
No.
Or you just wanna stand in the back of the room and yell at us? Sounds good.
I'll talk briefly here, but I'll come up with Carrie. I'm going to say this just because I don't work much with the coroner's office as much as Carrie and my other investigators, but I do support what my investigators do, and this is where we're at. We need to make sure we have efficient services, and, you know, kind of that's where we're at right now. So, I guess the ball, the questions here, that's where we're at.
Carrie, I don't know if you wanna share a recent experience that you've had?
Yeah, so I've been in investigations for 7 years, and I'm here for 14. In my time, I've seen Dr. Moore at one murder-suicide back in 2021. While I've seen her outside of professional capacity numerous times, only once at that scene. Her second in command is typically the one who answers the calls from their death investigators. She lives in Rock County, Iowa, has a family, has no intention of coming back anytime soon. A recent experience, we had a death about 2 months ago now, and I had emailed both Dr. Moore and Megan, her second in command, and hadn't heard anything. And so after a month and a half went by, I reached out to Julie, who was one of the assistants, to even get some sort of an answer as to why I haven't heard anything. We're finding that on a lot of our deaths, it's difficult to get a hold of Kellyanne or her second Megan, and there's a lot of times that we haven't even had an assistant able to come out and assist us, and so a lot of it's being done over the phone, which is not ideal, given that I don't have specialized training in the areas that they have for training, and we're getting a lot of slow responses or no responses to things that really, you know, people are asking for death certificates and things, even to Renee and to Mom and Scott, and we're not getting responses.
What do you do with the no response then?
We wait.
Yeah.
Oh. So you.
The coroner has the jurisdiction, or the legal authority to pronounce a death, we don't.
And so there's a lot of times that we'll have deputies out at cases, and we're, you know, maybe 2 deputies that are tied up on a case until we get a hold of someone or make some sort of arrangement to figure out how to locate them. The downside also is, I'm only aware of one of our coroner assistants who actually lives in Steele County. And so response times are also longer because I don't want to waiting to get a hold of them, we're waiting for their response time when they do come.
So I do want to make a comment here that Kellyanne's services and the coroner's office has been wonderful to work with up until recent times. So that's where we're at now, is it just a matter of trying to fix what we need to complete here.
What changed, you know?
I don't have the answer.
Dr. Moore used to work at Mayo Clinic and was able to have access to all those records and was available by phone during her business hours. I'm not sure, it might have been 2 years now. She left Mayo Clinic and works at the Waseca prison as essentially their doctor, and she's not available by phone during her work hours. So that's a large part of her investigators not being able to get a hold of her for determinations and having to reach out to Megan, who also has her own workload and a new baby at home, so she's not always available by phone either.
So I'm sure you've discussed this with Dr. Moore or not?
I haven't had any conversation with Dr. Moore.
I reached out to her via email and had not responded. She's not responded in about a month and a half.
Well, so we gotta do something then.
Well, and I think I started out by saying this is not a reflection on the quality of work that she does. I think it's really coming down to her ability to manage 2 demanding positions, and I think we need better response. And I think that was really OPD's position as well, was the fact that they too have been left waiting for a response or for someone to appear. And when you don't have an organization behind you, it makes it very, very difficult when you yourself are tied up. And, you know, we can call it Midwest and somebody will actually answer the phone on the second ring. You know, so we have that response. Mayo is the same way, where there's staff and a team that are available. And I think that's half of it right there, is that we might have just outgrown the level of service that Dr. Moore is able to provide.
I would agree with that, it is definitely possible she is overwhelmed with other business items.
Is the county legally on the hook for this, not prompt service, or?
Well, we're on a contract that, always has an option.
I mean, what you are asking about on the hook, are we, is liabilities involved? I can't answer that, I don't have an answer to that. We're one of 3 counties have an independent, coroner. It's a vital position to the county. The county is obligated to have a coroner. So it's the board's authority under Minnesota statute to appoint a coroner. It's no longer an elected position. And so, what obligations you have, they would fall back on you, I don't know, but I think staff recommendation is to move forward with a different coroner based on recommendations from OPD, Sheriff's Office, my office, based on concerns of fellow county attorneys regarding testimony and other issues that we work on that, why I prompted looking into it, and as well as the renewal of the contract. And I think it's just good timing otherwise. But the Midwest Medical Examiner, the Ramsey, Minnesota, has 35 counties, including Rice and Waseca. And then, I'll say the competitor, if you will, would be in our area, would be Southern Minnesota Regional Medical Examiner's Office out of Mayo, who actually does our current autopsies on a per autopsy basis, pay that fee, and then that'd be like Olmsted, Dodge, Fillmore, Goodyear, Washington, Wabasha, and that southeast Minnesota. So we're kind of right in that middle. So, and I believe Freeborn uses actual Ramsey County.
That I can't comment on.
So is there, Mr. Chair,
Right.
so is there a concern in use, if we did opt to go with the Midwest Medical as an option, is there a concern geographically? Or
As long as they can handle the call, that's what we,
you don't care where they're at? Clearly, as stated by our county attorney, we're servicing Rice County and Waseca County already, so we can handle this area.
Yeah.
That's the first question. Second question is, are there any additional fees that we're not seeing in the contract? I thought one of them maybe had some additional add-ons, or?
I think it's all per capita, like they cover all fees. My understanding, maybe right, it's like, just it's per capita, it's all included.
In reading through them, it's pretty all-inclusive.
And I'm looking to Rebecca, because this was a project that she spearheaded for me, which was to do the research and reach out to the 2 organizations. So Midwest has an interesting sort of, we provide the transportation with a credit back kind of a thing. So I think there could potentially be a small transport fee depending upon if they had to take the body somewhere other than within Steele County. But otherwise they will use local death investigators, so we're not paying for somebody to be driving down from Ramsey, Minnesota, for example. Mayo would do the same thing. We're not paying for somebody to come over from Rochester.
Right.
So ultimately, my counterpart in Chisago County was very, very helpful in helping me to understand how Chisago County has used them. And he provided me with their annual report. And so what Midwest does for them is it literally documents all deaths in the county, the cause of death. They've even gone deeper and provided information regarding drug-related causes, which I think could be very helpful for public health to understand whether we have any trends, epidemic-like problems with overdose deaths, so fentanyl, opioids, and that sort of thing. So he felt that their reporting was very, very helpful. Now, the county administrator, like me, doesn't really have any direct contact, so he reached out to the sheriff's office. And the sheriff's office has said they have no complaints, that they're very satisfied with Midwest. So in reaching out to them, their pricing structure, as the county attorney indicated, is a flat rate per resident or per capita. Midwest Medical is currently charging $2.71 per person. They did indicate that their rates starting in 2027 would go up to $2.91. It's a flat fee paid quarterly. The Southern Minnesota Regional, their rates are a little bit higher, and they're at $3.46 per capita. Their 2027 rate would jump up to $3.53. Again, based on recommendations, referrals, and other feedback that we've received, they are of comparable quality, and because of the volume of counties that Midwest serves, we think that they probably are giving us a bit of a volume discount. And so if the board is inclined to contract with a service such as this, we would recommend entering into discussions with Midwest, and then we would bring a contract back to the board for formal consideration at a later meeting. If, however, you wanted to stay with Dr. Moore, then we would reach out to her to find out what the terms would be for her renewal contract for 27.
So we are under contract through this 26,
Correct.
more?
Mhm.
So the new contract would start in January?
Yes, although if Dr. Moore decided that she wanted to discontinue that contract, there is some flexibility. So if she wanted to sever the relationship early, we could entertain that because both of the organizations have the capacity to take us on prior to 1/1/27.
So it's hard to know if she doesn't call back.
Mr. Chair? I guess in looking at the two programs, I think the Midwest Medical, seeing they're in Rice County and Waseca County already, I think that not only would behoove us, we would get examiners a lot quicker, even if we didn't have one located right here. And second of all, there's about $23,000 a year difference between the two. Midwest is a little less money, and I would just also like to add, I don't think it's fair for our investigators to have to go through this and not know who or when or what's gonna show up. And I really don't think it's fair to families that are caught in a bind, and that really irritates me. So I would like to move this forward to our county board meeting to make a change.
Rob, is she out of, is she not abiding the contract by not doing this?
We could explore that option, generally speaking. I was asked to look into that by the committee, and I think it would take further action of the board. And so I would like to explore speaking with Dr. Moore prior to making a recommendation on proceeding with the contract.
So if we move forward tonight at the meeting, we could say as of January 1st.
Certainly, absolutely, January 1st.
And then if she agrees, we can move forward earlier?
We can move forward earlier under a couple different avenues, which could include agreement or otherwise.
And again, we're not asking the board for a decision other than direction this evening. We would then go back and work with the provider of your choice to then develop a contract that would be brought back to a future board meeting. And in the meantime, we could certainly try to reach out to Dr. Moore again and just see if we can initiate a dialogue about her preferences or wishes moving forward.
And I would like to clarify, because Waseca and Freeborn use Ramsey County
Oh.
versus Rice uses Midwest Medical Examiner in Ramsey, Minnesota. So sometimes it gets a little confusing. So, yes.
So they would also bring back an updated fee schedule, because the one that's presented here is dated 2017.
Yeah, we just asked for sample contracts. We didn't ask them to put any time or effort into drafting an agreement specific for us. So yes, the samples that you see are just provided by the organization, just to give you a sense of how their contracts are structured. But yes, we would have something that is updated for us with 2027 rates.
Do you guys' recommendations as well, right?
We're gonna follow what's best for us.
Alright. Any more discussion on this? And then we'll move on to annex building feasibility study proposals. Thank you.
Good afternoon, Commissioners. So at the previous work session, the board requested proposals to do the annex building feasibility study. The purpose of the study was to evaluate whether the existing public health annex building is a viable candidate for reinvestment and interior reconfiguration to accommodate the future needs of public health. So with that, we got, two proposals, one from, SiteLogix. So their proposal was $4,000 for facilities planning and comprehensive assessment service, indoor air quality, indoor asbestos testing, and total facility service. And the total of the service provided would be $10,849. Which if we moved forward with them with a project, 4,000 of that would be waived. So basically, we'd have to pay for the indoor air quality and the interior asbestos testing. Then the second proposal was for mold. They had a similar, I should back up to SiteLogix. So they did have the roof inspection as well as structural, that was kind of included in their facility planning. So Wold was similar, but they have a no cost with the planning and coordination, kind of like the facility assessment. But the reimbursables would be the structural evaluation of $3,000, indoor air quality of $5,040, the roof inspection $4,800, and then asbestos inspection, which was $9,370. So that would be payable to Wold. So I guess with that, is there questions, discussion?
So, Mr. Chair. SiteLogix, thank you. So if we, let's say we went with their proposal, $10,849. And then after we receive the information, we decide that, we're gonna move forward with the project, but we don't need their assistance anymore. They are due, they get paid the $10,849.
Right.
But there's not on the hook for additional costs or any, additional services beyond this.
Right.
And just to clarify what SiteLogix is proposing, again, we got a little bit backwards. We are prepared to bring SiteLogix to the board at your next regular meeting to talk through the services that they would offer to the county as a whole. So if you just took the annex off the table, SiteLogix wanted to come in and make a presentation to the board. They came to our facilities meeting last week to walk through the services that they provide. They do a comprehensive evaluation of every building, and with the understanding that there's no cost to that evaluation. However, if at some point down the road, we need their kind of expertise and guidance to do a project, whether it's a renovation of an existing building, new construction, or whatever the case might be, then there would be no cost for that intensive building evaluation. So when they talk about that in the proposal specific to the annex, they're leaving open the door that they might be, retained to provide this ongoing advice and guidance to the county. And so whether we use them to manage a project involving the annex, or we use them to manage a project somewhere else in the county, then that fee, that $4,000 would be waived. So what they're proposing to do is to do a comprehensive, roof to foundation evaluation of the annex. So that would serve as the foundation for the work that they would do countywide if they in fact are retained to provide that guidance.
Jay, can you get subcontractors to do all this, the same stuff that they're doing or not?
So the asbestos inspection, we're gonna have to do, basically if we go in there and renovate, or if we decide to demolish, we're gonna have to do that anyways. The indoor air quality, we've had them in the past, so, there's companies out there that, I have contacts for.
So we've had those buildings tested.
I think the last one was done like a year and a half. Maybe 2 years, but.
I know when me and John first came on, that was a big issue over there, with the highway department. and it was checked a couple different times from one end to the other, and it turned out okay. I think at one time, I think there was a slight gas leak coming in from the gas service, there was a slight leak that they had found, but otherwise air quality was okay. That was, we're talking,
14 years ago.
But he just said it would happen 2 years ago.
yeah, but, okay, but we had, yeah.
So it's been checked more
It's
than
been
once.
checked more than once.
And I think there's two things that might, to answer your question, yes, we could hire Braun, we could hire these companies, but both of these companies also will be doing a site layout. The building as it's currently configured does not work. It is not conducive, there is no private space, there's no non-public space, there's no employee space that is separate, and the big U does not allow for us to divide and allow for a lunchroom that is not in a public space, for exam rooms that you can't overhear sitting in a conference room and that sort of thing. So we're still gonna need a designer, and both SiteLogic and Wold would have the architectural teams to be able to put together a design for the board to say that to make this a functional space based on the needs of public health, this is what the layout would look like. So you're gonna know, is the foundation adequate for that redesign? What would the roof need to look like for that design? What does the interior structures, the mechanicals, because right now we've got a couple of residential units. Are those really the right units for a redesign and a remodeling of that building? So the testing is just one piece of it, but it's putting it together with what the design of that building needs to be to make it functional for public health. And I think ultimately that's gonna be the presentation to the board, and then there will be a cost associated with what does it take to remediate the conditions, what will it take to rehab and renovate and reconstruct that building to make it functional so that the board would have something then to compare with as they determine, is it more cost effective to renovate that building, or is it more cost effective to look at a different design model? So I think ultimately, this package approach is what staff is recommending, because that design is gonna be inherently important when it comes to taking the results of those studies and making a recommendation to the board.
But there's no design in this proposal.
It is,
So
unfortunately,
facilities planning they're gonna design it?
yes.
Well, there would be concepts, not like a full-fledged.
Oh, I'm sorry, yes, yeah, I mean, at this point, we'll do like a 50% design, SiteLogic would be doing something, so it's not, they won't be engineered drawings, let's put it that way, they won't be construction ready.
Well, with Wold, would they be construction ready? or
No, they'll
Be
be,
a concept?
So what if we went, and I'm just throwing out a third option, what if we did a design build? We have Metcon up the road, we have local contractor, Lowe's contracting. We have APX over in Mankato, and I'm sure there's 2 or 3 in Rochester, all around us, there's contractors that could do this type of work, and it's a one-stop shop. I would say if we're designing a brand new building, yeah, we might need to have architects and others involved, but there's people that do this stuff every single day, and they do with municipalities. It's not a new concept to look at that as an option.
Right.
I mean, I think when we hired Jake, you correct me if I'm wrong, but I think when we hired you, you have that experience, you worked at Metcon, right? And that was part of the package that Jake can manage these projects or has that management background. And I'm not advocating you manage it, I'm just saying, we haven't even considered that as an option. If we were building brand new, I would say, yeah, we need an architect but I don't know if we need a full-blown architect involved in this project.
But
So Rob, correct me if I'm wrong, but if you go a design build, would that have to be like a best value bid?
I have no idea, I'm sorry, I can't.
Yeah, so I think that would have to be a best value, which
it
But
could explain-
who determines best value?
I think that there's a committee or the board does, yes.
So you design it, and then it would go out for bids based off the design, right?
So how the best value, and I've never been involved in one, but the way I understand they work is they put a package, you say, okay, here's our 10 top criteria for this project, right? We wanna know your management team and their experience, we wanna know similar projects, and then you grade all that. And then whoever has basically the highest point and how you grade them is who you would ultimately award the contract to. So
who you would feel will bring the best value to the county for that project.
Generally, call them in, you talk to people, and then have a clarification.
Right.
And you provide the scoring up front, so like you would consider cost, you would consider material, you would consider design, but generally you try to provide them, that would be scored out, so that it's, very clear and fair to them in their proposals, and then you get a more apples to apples review of their proposal.
So who does Metcon do, who do they use to design these things? Do they have internal,
No, so like
They would hire
McCon,
someone
they
else.
would hire like ISG or,
an architect?
yeah.
Some of them have their own too.
Some do have them, yes.
APX has their own internal.
And actually, years ago, McCon did have an architect on staff, but
AJ Leslie have his own?
I don't know if they're around anymore.
They pretty much work it out now.
Yeah.
So,
And I think a lot of what we're, indoor quality testing, asbestos testing, that all is part of the whole remodel. I mean, that's gonna be part of the process. So if we're gonna pay for this up front, and then do we avoid it later? Is that the idea?
yeah, cause you would have the report for like the asbestos, obviously, and then at that point, you know, depending on what you did with it, you would have to go and abate it, which is an additional cost.
And asbestos is, in its solid state, is not an issue, it's when you start
Right.
doing remodels
Correct.
and moving it, right?
Right.
Have there been asbestos in 85 of those buildings? Maybe not in this part, but another part.
Yeah, the other part hasn't been, yeah.
And probably the elbows and
Yeah.
wrapping on the
And
pipes.
in 85, you could still have some residual, you know, elbow, I mean, cause they used the stuff until it was gone, basically. I think they put manufacturing like 79 or something, but, you know, obviously there's supply. I heard it was like 84, but then when I was talking to one of these guys, they said they've actually seen buildings in 85 have it.
Okay.
So we're talking just in the heating aspect, not linoleum or,
it could very well be in linoleum tiles on the.
I know it can be, but-
Yeah.
But in the old part, it could be, and the one guy, that Site Logic had come out and look, he was IEA, they think it's in the soffit as well. There's the material they use, they think that was all asbestos containing.
Right, there's a whole abatement process. It's not a common, there's a whole abatement process
Yes.
that goes into this.
Right.
So the question before the board, and my apologies if this wasn't what you were looking for, but the board, as I understood it, wanted more information to make a decision as to whether renovating that building was a more efficient use of taxpayer dollars, or putting an addition on this building was more efficient. So our goal was to bring information from Walden Site Logic that would hopefully give you the tools with that layout and with a construction estimate for completely gutting and renovating that building so that the board could determine which is the most cost-effective option. If the board chooses to put an addition on, we can sell that building as is. Obviously, the environmental studies and whatnot might aid or assist somebody's decision to buy it or not, at least they would know what they're getting into. But ultimately, if the board has committed to, we're just gonna renovate it and take it, whatever the cost might be, then absolutely, we could bring in a couple of different contractors and have presentations over what that is, but now you've committed to a remodel without having the tools to determine whether that's the most cost-effective approach or not.
So, Mr. Chair, question, so the bullet item here, the $4,000 facilities plan, whose vision is of what that plan is gonna look like?
They actually have a team, so they would work with Amber and her staff. They would hold focus groups to talk about, you know, what does the treatment area need to look like? What do the private spaces need to look like? What do the group spaces need to look like? How does her team work? And taking a look at how do we separate employee spaces from public spaces, and then how do we create those private spaces for treatment and patient care and all of the different services that they provide. How do people move from room to room, from the lobby to the front door, and that sort of thing. So I would assume that Bold would do something similar, but SiteLogic actually has a team that talks with the actual users of the space, talking about service delivery, best practice and that sort of thing. So they would be drawing information and inspiration from the people that would actually be occupying and using it to determine what those layout plans need to look like.
Well, Mr. Chair, I would think there might be some DHS requirements on some of that stuff as far as,
And, well, just ADA compliant stuff, yeah.
Mr. Chair, clearly there's gonna need to be some private space. Everybody understands that. Not everybody needs an office or a full-blown office. There can be cubicle type setups but that's where my question kind of lies is, who's gonna be involved in that planning? Because that makes a huge difference in what the overall cost is gonna be and with that number that is presented to us. You know, that last number that was presented to us, that's a big number. And it certainly was approaching what they believe the cost would be to put an addition on. Now, we can argue or banter back and forth on how accurate those numbers are. I think those numbers are inflated, honestly. I mean, looking at them, those are big numbers that, and you can go whatever number you want there to make it look like you need to build a new building. I don't buy it. I think it's inflated. I think you can get a hell of a big, excuse my French, but a big bang for your buck for a lot less than what's being proposed there. But I'd like to know a little bit more about what's going into that planning, and we can approve it with that, but somebody from this board should be involved in that planning piece, so we know more what's involved in that. Because I think that drives a lot of the cost.
Well, and right now, we've got people in cubicles carved out of hallways.
We
We've
know
got
that. We know
private
that.
spaces that can be heard. So the bottom line is that I don't think Amber's team is gonna be unrealistic or unreasonable, because they're sitting in a really, really non-functioning space right now. So anything's gonna be an improvement, but we have to be able to move people in and through where there can be public hallways. Right now, they're being taken through private offices to get to the WIC spaces. The employee lunchroom is easily accessible to the public. We have to give them some credit for identifying how they currently choose to work and collaborate and whatnot, and allow, whether it's Mold or SiteLogic or both, to be able to put some concepts together. And absolutely, the board can take a look at it and contest it, but it should never be our decision to tell Amber's team how they're going to do their business.
I
And so
think
we
you're
need their
putting words
input.
in my mouth. That's
No.
not what I said.
I'm putting my words out on
No,
the
that's
floor
not
here,
what I said.
which is, we need to let them guide this process with appropriate checks and balances.
So yeah, I think, each firm would definitely do different concepts. That, we bring to the building committee and, or, to the work sessions, we would review. But I think that it would be valuable to get somebody on the team to help us continue to move forward with making this decision, right? Obviously, we can all agree that something probably needs to be done. I don't think there's any dispute, but I think one of these, or somebody needs to start putting concepts so we can start getting some better numbers, if you will, rather than just square foot numbers.
Sure.
yes.
I don't agree. Everyone up here knows something needs to be done. Amber knows something needs to be done. You've heard Renee tell us something needs to be done. There's no doubt. I think the question is, what's the scope of that project and how much is the taxpayer willing to spend? Because ultimately, that's whose money we're spending. Every one of us up here, when we make a decision, that's their dollars. And then we do have to have the information, the data. So I would agree. I think we need to do something. I think if it's IQ Logic, that's fine. I don't want to enter into a long-term contract with IQ Logic, and we can have that discussion later on a different scale, but, for $10,849, if they can get us the data we need and give us some sort of conceptual drawing, I think that's a valuable tool in helping us make an educated decision.
What's the difference? Like, I'm looking at it just seems like Wolf's way more comprehensive, like,
So.
they don't look like they're apples to apples.
So, Wold doesn't have structural engineers on staff, they're, an architectural firm, so they have to use this BKVM. Obviously, that's the cost, and then, they went and got prices from Braun.
But
and
SiteLogic doesn't have any of that.
Because
Well,
they have all those little
Psychologic has a
steps.
lot of the people on staff.
so
that do that.
SiteLogic has
So
structural,
where is that spelled out in this fee sheet? That's what I'm asking.
Because it's internal to them, there's no additional cost. They
Oh,
use
so
their
they
team.
just,
Yes,
right, so if you look at the scope of the
or
work,
it just says,
yeah, and then they've used obviously different companies, IEA out of Rochester, and, you know, I don't remember if I've ever worked with IEA, but Braun, you know, they do, I worked with them several times, they do awesome work.
as long as we're getting the same value, I mean, the structural stuff, the indoor quality, roof inspection, that's what I'm asking. It's just making sure we're getting that same proposed component to go.
Yeah, I think you're gonna get the same type of end product from both of them. It's just that their approach is different. SiteLogic has the staff on board that do that, where Wold has to bring in outside groups.
You know, and if I can make it, you know, I would almost forego the asbestos, because we know that there's gonna be some in there. So I mean, that needs to come, it's not like we can make that cost go away if we do anything, but I think for now, trying to determine which direction to go. You know, because at the end of the day, maybe it does come back, you know, we need to do an addition here, or, you know, and then we sell that building. Well, we're not obligated to provide an asbestos report.
Oh, I see what you mean.
That's a good recommendation.
You worked with Braun, we worked with Wold, we haven't worked with SiteLogic, except for in this building. And, I don't know how to say it, but he was a superintendent of schools, now he's working there. I mean, I don't know, his background is not that, you know what I mean? I don't know if he's there as a salesperson there. Yeah, I mean,
I think that's a valid question, but he's only one of a broader team. But I think they have the credentials to do it.
and they've been around a long time.
I believe so, so I met him here.
The way that they explained it to the building group was the fact that they started out doing school districts and then found out that their concept was working well for smaller cities and counties, because their approach is totally different than it is for, than it is with Wold. And it was a real interesting presentation. That's why we wanted them to come back and do it to the whole board.
So who had the original presentation that they came, I mean, did they come to us and give a presentation or how?
Yeah, so they met with, I think Renee was introduced to them at a meeting or conference or something, and then they came and talked with us, and then we brought them to the building committee, and this is while all this is kinda going on, so that's why we kinda got a little backwards here.
Oh, so they presented to the building committee?
Just of their services, not
Yeah,
necessarily
That's you and who else?
Commissioner Brady.
Great.
Well, when they presented after, they'd already performed some work. Right.
Yeah, Renee had, but there was no cost for that.
so they had asked for a couple of buildings that they could use as the basis for their presentation to show how they take their study, their research, because their product is a dashboard. Their service is to help the leadership, so in this case, the county board, make informed decisions about the timing of facilities maintenance and management, as well as cost projections to help with forecasting when the work might need to be done, and are there ways to balance it out year over year. So what was presented to the Property and Maintenance Committee, and which will also be presented to the full board on the 28th, is that planning dashboard. So every system, every mechanical system, every light bulb, everything in every building is tracked and documented and built into this dashboard that then says, let's look across the entire spectrum of all the county facilities to determine how can we best plan for repairs, renovations, replacement, and so on a rolling basis.
And how do they best fit into the financing? They had an entire package, and what impressed me about him is we own that software. That's Jake's. So he has a schedule then that he can look at as far as what could or should be done at certain times and how it fits into a financing plan and all of that. And what I really liked about it was, I think they used 5 years, wasn't it? And they put a fee of, what, $46,000 on that?
Yeah, that sounds right.
Something like that. And if at the end of that 5-year period, wasn't it, that we didn't use them for a project? He said, you don't have to use this for a project, and you still own this, then you would pay that $46,000 fee. But if you used them for a project, then that fee goes away. No.
Yeah, it goes away, it just gets baked into the project,
But
I get it. Well, we know that, I mean, that's reality.
it is reality, Jim, but it's not, they're trying to put a different program together.
I understand that.
And their program makes sense.
So if you look at their program, and we can talk about that when we come forward, but I think there's some flaws in the system. It doesn't take into account the maintenance that's been done on some of those items that they're scoring 0 on or 10. So it brings the overall score down on the dashboard. So if you look at the whole thing, there's some legitimate questions that need to be asked of site logic IQ when we get to that point. I think it's valuable, I understand that, but we gotta look at it with open eyes.
Mr. Chair, if I may, they can go in and update, like if you were to go in and replace the inner workings of the HVAC system, you can go in and put the dates of that in there so that it does account for work that has been done, which I'm sure they can explain and share that with you.
So the work on, so when that building scored at 25, was that added in there? The work that had been done?
It was scored based on the facilities, the infrastructure that they did examine. They didn't go,
No.
like I said, they didn't go roof to foundation end to end. They just did a high level to show how their work is. And as they explained when they were here at your meeting last time, they talked about the fact that they look at functional age, but they also look at things that might have been done to it that would extend that useful life. And they're actually developing an interface with our work order system so that when Jake puts something into our work order system, it automatically updates those components. So if there was an inner working replaced, that gets updated. So it's a variety of factors. I know your comment when they were here is that it's not black and white, it's not exact science, but some things age quicker because of what they are. Maybe they weren't sized properly to begin with. Some things have a longer useful life. And so they're looking out over the spectrum. But again, their tool is merely for decision-making purposes, so that we don't find ourselves in this situation in the future. That the board is able to look at a dashboard. You don't have to wait for staff to put together a CIP and tell you what we think is coming up. You can literally look at this dashboard at any time and know that over a 5, 10, 20, 30, 40-year period of time, you're gonna be replacing a roof here or there. You're gonna be replacing the ventilation systems. And the goal here is to give you actionable tools so that the board can make decisions. And one of the nice things about their dashboard is if you say, well, I don't think we need to do this roofing project in this year, I'm gonna move it out 3 years, they'll actually re-estimate what the cost of that roof will be in 3 years, because your goal was to try to have that investment be flat year over year. So this dashboard gives you the opportunity to say, let's combine these 3 things and make them a project, because they're all of comparable age or condition. And if we do that in this year, then that frees up dollars in year 2 or year 3 or year 10. And so all it does for us is it offers good information for the board to make informed decisions going forward, because we want you to be confident in the decisions that you're making, because as you pointed out, you are spending taxpayer dollars. And we want the board to be able to say, we've looked across the spectrum, we know where the county's gonna be in 5, 10, 15, 20 years, and this is the right thing to do. So I'm getting ahead because they'll be here at your work session next meeting. So if you ultimately want to hear that presentation before we move forward with either Wold or SiteLogic, we can certainly, because we weren't expecting the board to make a decision tonight, but ultimately we are looking to the board to make sure that we know, I mean, so far Commissioner Abbey has been the most vocal. I need to know what the other 4 of you need to make sure we're getting you that information so that when you do make that decision, you're moving in a direction that at least the majority of you view as the right plan.
Mr. Chair.
Yes.
Okay, when we got Site Logic's first stuff, and when we looked at over there, when we were supposed to make our decision on before, right in their own readings, and the third sentence down, says the following information outlines why a new addition represents a more responsible long-term investment for taxpayers and a more efficient way to serve residents. Right away, they're saying, the following information outlines why we need a new addition. Now, the public ain't stupid, and Site Logic, they came and gave a presentation, the old superintendent, and he said that his board had hired Site Logic to look at the old town high school. And they came back with 80 million, his own words, 80 million in maintenance that was put away, you know, what's the word? Deferred maintenance. And I'm just scared we're hiring the same group that's gonna come in and they're gonna nitpick and pull numbers out of the sky. You know, that's my fear way deep down. That's just me.
Well, we
It
can,
might be unfounded, but that's the thinking going on in my head.
I think tonight though, we're not looking to hire them long term, we're trying to determine if we wanna use them to just do this piece, right?
I'm all for getting what we need to get done, because if we do something over there, I wanna rip out from wall to wall and redo it. That's 1985 and prior, and if we do something that's gonna be ripped out, we're gonna get up to 2026, you know?
Exactly.
So that's what I'm looking at getting done.
Quick question, Jake, on the wall proposal. The first item is the structural evaluation. Can we just call Wall, for example, and say, hey, can we start with this and pay $3,000 for that? If the structural evaluation is no good, we don't need to move forward. You know what I mean? We spend $3,000, and they come back and they say, hey, this is solid. Then we go back and spend more money, but we can start with the $3,000. That's kind of what I felt like we asked for at the last meeting, you know, to see if it's structurally able to put a roof on it. I mean, rather than spend $22,000, we work with Wool, we can do the structural part first. I mean, spend $3,000 and move from there. I mean, if they tell us that it's not structurally worthwhile, then we move on, you know what I mean? Rather than spend $22,000, we spend $3,000, or whether we do it with Site Logic, but we have a relationship with them.
Right, and I think either company would definitely do that. You know, obviously, we would be hiring them, so we would tell them, you know, to me, this is kind of a la carte, right? Like, we can say we want this, this, and this, or we just want this, so.
Like you said, the asbestos, we know there's asbestos in it, so to spend the $9,300 seems crazy. But maybe after they say the structure is structurally efficient or it's not, then we go with the indoor air quality and the roof, or, you know, the roof inspection or whatever. Or maybe have them do the structural and the roof at the same time, and then we know where we're at. I mean, if it's something we can even add on to or not, I mean, they'll tell us that.
Would you, if you went with the Site Logic, remove the indoor asbestos, it's $5,800 total. And we're supposed to be getting the same apples to apples, right? So to me, that makes more sense, if that's the way it's going.
I think, I hear the argument. If we determine that it's structurally sound and we wanna go that direction, if there is an air quality issue, you said you had it tested, we know there's asbestos, if we're gonna gut that thing out, and all that's gonna be addressed when it gets cleaned up. Right. If there's air quality issues, it gets taken care
So it won't be beforehand.
of. Exactly.
I mean,
Then we're not in any contract technically, right? So
No.
we just get all the documentation, review it, and make a decision.
you work with Braun, so they can do the roof inspection and the structural part, you know what I mean? That's kind of what we want to know first, rather than spend $22,000.
I think you're looking at,
Yeah,
you're looking at what he's.
I'm leaning towards Lowell. I don't know, I haven't had a presentation from the Site Logic. I don't know enough about them to make a commitment.
Well, I think that's why the whole board needs to hear the presentation.
Right, if we're looking for an answer today, I'd say Lowell, I mean, because of that.
So in order to do a structural restoration, we do have to have some idea of what the layout is. So,
Structural evaluation,
But we know the roof needs to be completely replaced, but replaced with what or how and what shape depends entirely on what the footprint of that finished product's gonna look like. So, again, I don't know how much information you would need to determine which is the most cost-effective route. And I want to make sure that whatever we put together and bring to the board, that the board hopefully isn't left wondering, well, what about? So if we came back with a concept design with an analysis of whether the footprint and the existing physical structures could support that or what that would take, we know the roof needs to be replaced, so it's just more a question of with what? And how deep do they need to go down into the trusses and that sort of thing?
That's the number one question. And then if they remodel, they do probably redo something different anyhow.
So I've heard you say that a couple of times, whether or not the structure can support what we're looking for. What do you mean? Like, would you mean to house public health?
Yes, to house public health.
So how many square feet is that building?
You
I'm wondering how many square feet that overall building is.
And I'm not talking about square footage, I'm talking about a U-shaped design that was meant for a dorm. It worked great for a dorm, it doesn't work for today's public health needs and uses. So if we start taking out interior walls to create different spaces, if we have to reconfigure the entryway, all of those load-bearing walls will shift and change, and the roof design will have to shift and change with it. So that's where I'm saying we need to understand what that layout needs to be for effective delivery of public health services in order to determine how much of the existing systems can stay and what needs to be removed.
Can they put, can we have both of them put together a concept? We don't have to pay for anything, right? I would assume that you could ask if they put a concept together and they both do it, cause they want a business. And we decide what kind of, we just did it.
Right, so with the concept, so there's, we say concept design, right? And that would take you up to like 20%, and then from there you could, of 100% design. And I think when these guys talk about like the kind of concept that's a no charge, if some of you remember, they used to call them bubble diagrams, where they're putting in these pieces and how it would all flow and fit. So that's, I think, what we would get. But I can definitely check, and that's what I'm kind of hearing, is that maybe we wanna say, what is the cost to actually take us to the 20%? But I still think we need to evaluate both projects, right? But we need some hard numbers on each one, or not hard numbers, but, better budget numbers on them.
Mr. Chair, I almost feel like it's predetermined that this facility is not gonna work. That we need a new building, and come H or high water, this is what we're gonna push for until we get that what we want. To tell me that 18,000 square feet will not house public health, I'm not buying it. Right now, we're using about 13,000 square feet is my guess. And then we have extension in there also, right? And with the two of them. There's a lot of wasted space in the current design. To gut that building out, and it's a blank slate, 18,000 square feet, is adequate space. And to continue to say that I don't think it's gonna work, or we don't know if it's gonna work, and we're just planting that seed that we need to build a new building. And I'm not there, and I don't know if I'll ever get there. I think that's an adequate space, and we can remodel that for a fraction of the cost of what it costs to build a new building. Anybody can put numbers on paper and make it look like it's gonna cost the same amount as building new. I'm not buying that at all.
I was in the boat, we were still talking about using the U shape, but if you're gonna gut the whole thing, you're also gonna be raising the ceilings 2 feet, and then you start getting into that structural stuff. That's what I thought we were talking about. Like, let's find out if this is the way it has to be. You can redesign the inside however you want, but it's still gonna be a lot of money. But I wanna see if that's even feasible based on that footing foundation that's there. And I think either one of them could do that. I just thought you could get more than one.
One
Yeah,
idea
some sort
or
of-
one concept?
Yeah, I'd competition. I think they would.
Right, it might be nice to have more than one, but
Well, I mean, if the message is, you know, can you design us a plan in this footprint? Or can you design us a plan that you can make work in this footprint? It depends on how it's presented to them. They're gonna do whatever you want, right? We're almost out of time here.
is there any direction in that, or do we want to do it into the agenda?
Well, I think I've heard, ideally, they both present us a concept. If they're willing.
We're gonna move to the agenda of the board meeting?
There's nothing to move for action tonight. However, what we are hearing is that the board wants to scale back the study piece of it to only include structural. Don't do environmental testing or asbestos testing. And that we would need some type of a bubble style or layout. And, you know,
Based on what you and Amber think you need for spacing, I guess. You know what I mean? If that isn't feasible, I think there'll have to be another conversation. I don't know what else.
so is that kind of the consensus? We'll talk with both of them. SiteLogic will be at your work session on the 28th. That might change your opinion of using them or not using them, but at least you'll hear what their approach is to facilities management. And then Jake can reach out to the two to make sure that they're both willing to put that effort in and whether there would be an additional cost to it. And then we'll go from there.
Thanks, Rick.